All right, folks, let's talk lung cancer screening. And Dr. Pfeiffer on the air with Mr. Mangino right now. He, of course, the star, the host of the show, and I get to come along for the ride and learn all sorts of great information. And I've been a part of this show on and off for the last 20 plus years, and it's always exciting to get together with some of the medical minds from the Allegheny Health Network, part of the Highmark Healthcare Company. Dr. Mueller, Dr. Finley, it's all about that dreaded disease. My father died from it, and it is an ugly and very frightening disease. So, is it really smoking the main reason people get lung cancer?
Yes, absolutely. Smoking is well known to cause lung cancer in this country and worldwide. And we need to find a better way to detect lung cancer at an earlier stage, when it's at a more treatable stage, and you can save lives.
One of the things that I learned many years ago from a good friend, Dr. Rodney Landrino, lung capacity, you're born with a lot of it, so by the time you're in trouble, you've really used a lot of it up. So is that one of the reasons why people do not get detected with this terrible disease until, in many cases, it's really done a lot of damage?
Yeah, that's correct. A lot of times when you notice the signs or symptoms of lung cancer, such as you can't breathe or you're coughing up blood, by then the lung cancer is an advanced stage and not very treatable.
One of the things that he also taught me many years ago, and he was so good in helping me with my father, who eventually passed from this disease in 2000, is the fact that minimally invasive surgery is now a part of lung cancer.
Absolutely. I mean, the new micro-invasive and the robotic techniques that they have now are really revolutionizing the way that we're treating lung cancer surgically. I'm not a surgeon, but Jeff and I interact with the surgeons all the time, and that's the wonderful thing about screening is you can find these at an early stage where they are still operable and curable. About 2/3 of patients present with lung cancer when they're stage 3 or stage 4, and those patients are not amenable to any surgical cure, and there we have to use things like radiation, chemotherapy, and now immunotherapy is a new thing.
All right, I'm going to end on a note that I'm sure a lot of people have done. When asked if they're smokers, they do not put it on that little chart that they get when they go get their, hopefully, yearly checkups from their family physician. And that means that you don't have a regular check, or at least someone looking into the possibility because of smoking, and we know how difficult it is for those of you out there to stop. If there is any damage, we talk about preventative health care and preventative testing. So if you are a smoker, when you get those regular examinations, please tell your doctor so they can follow up with a chest x-ray or do something just to make sure that even though smoking is bad, you're healthy.
Absolutely, absolutely. And if you enroll in a smoking cessation program, and stopping smoking is the most effective way to prevent lung cancer, a lot of insurance companies will give you a credit on your deductible or on your copays. So there's actually an incentive, a financial incentive to stop smoking.
Please join Dr. Finley, Dr. Mueller, and Dr. Pfeiffer. It's going to be an amazing show, and I'm sure a lot of you have a lot of questions. So please call early right after local news at 7, and that number is 866-391-1020. Dollar Bank Instant Access, KDK.com. And then right after the Allegheny Health Network program, Medical Frontiers, we will go to Bank of America Stadium, where the Carolina Panthers, 6-3, are getting set to take on the 4-4 Miami Dolphins. Westwood One Radio. It's Monday Night Football on News Radio 1020 KDK. Good evening.